First, let me introduce you to Dr. Mark Benden. I should say reintroduce you because he's been here before, but it's been a long time. Thanks for coming.
You're welcome. Glad to be here.
The last time he was here, we had a book, and today we have a desk.
It's changed a lot over the years.
It
There's been some progress made. Yeah.
And of course, he is the director of the Ergonomics Center in the Texas A&M Health Science Center. And so you have taken a theory and it's become a reality. Talk about that.
Sure. So when we began back in '06, we were looking at adults in offices and we noticed this sedentary pattern developing, and we coined the term at the time, technology-induced inactivity. And the idea was that as we've progressed with computers, the screen time, of course, was even back then off the charts. Now it's really gone exponential, right? Because we're all ticky-tacking everywhere we go. We were kind of shocked by that because we noticed that during the waking hours, the 18 or so hours a day that we're all up and out of bed, we were spending more and more of that time seated. And unfortunately, through epidemiological studies, we've shown that the more time we spend sitting, which correlates with very low inactivity levels, we see health patterns emerging that are negative, bad outcomes, coronary disease, we see cancer associations, we see mortality from all causes. So unfortunately for those of us whose jobs require us to be in an office, to be sedentary for our work, and then a lot of times we sit in the car to drive home in traffic, we go home and sit in front of the TV for hours and then finally go to bed, we're just not up and active. It's even created a phenomena called the exercising couch potato. This is really unfortunate for us all because, well, there are a number of us who take the prescribed, recommended 30 minutes a day, 4 or 5 days a week, and we get out and we do some sort of cardio, get on the treadmill, take a walk, take a jog, play some tennis or whatever. And we've been referring to those folks now as the exercising couch potatoes because what we're seeing is that they're getting that prescribed amount of recommended exercise, formal exercise in, but the rest of the time they're completely sedentary, sitting typically in front of a screen. And unfortunately, that little bit of exercise isn't enough to overcome the rest of the negative effects of being sedentary all the time. So we were created to be dynamic, we were created to be upright and mobile and to move about frequently and to change positions. It's how we heal ourselves, it's how we keep ourselves alert and awake and on task. And so for those of us who are kind of forced into this sedentarianism as part of maybe our occupation, or in the case of students in schools nowadays, it's something that's become to such an extreme we need a reversion, we need to step back. This is nothing new. We used to have schools that had upright desks. Many of us used to work in upright postures or positions. In fact, when I first came in the workforce, I worked in a machine shop. And I can remember a lot of the old timers coming around to me when I would be sitting on my stool, deburring a part, and they would say, "What are you doing?" And I'd say, "Well, I'm working." And they'd say, "No, you're not. You can't work sitting down on the job. You're sitting down on the job. Get up." And to them, it was just insulting that I would think of myself as working while seated. Now, in our lifetime, this is completely flip-flop, right?
It has.
Anything we do, we associate now, especially with computers, with seated work. But that's just a mindset, that's a paradigm, that's something we've sort of slowly gotten into over time, but it doesn't have to be that way. We have other ways to work. And so standing for us becomes not the alternative. In other words, we don't want to tell people to stand all the time, right? That wouldn't be good for us either. What we want to tell people is move more. So instead of sitting all day, move more. And standing becomes a proxy for that.
We have about 2 minutes, and I want people to be sure that they see that what we are looking at here, this is your research recommends high school students, middle school students, elementary students, and you don't see chairs with these, but we'll answer that question.
Sure.
We have a stool right here that, so you can see what the concept would be. But you've been doing research with this kind of product in a real place in this town.
Correct. So we've been in several area schools in Bryan and College Station, also in Navasota, working with the teachers and the students, the administration, trying to find ways to get the kids more engaged in the classwork, get them up and more alert, which is what we all do in a long, boring meeting. We stand up to wake ourselves up. And we've been providing these products to give them a place to act as a proxy for movement if they get fatigued they're able to, rest on the stool, but they're also able to get up and move about as well. So.
You know, this is just fabulous, and I know we have just scratched the surface. Here's the way you contact or connect with this kind of research and this way that they're doing things today. Texas A&M Health Science Center School of Public Health. For more information, sph.tamhsc.edu. And of course, here's the telephone number, 979-436-9405. We'll connect you and you can get answers to your questions. And it's so exciting that we've talked about it in book form and we're seeing the end of the research, and just congratulations on what you've been able to do.
Appreciate it.
Such a pleasure.